Today we are going to demonstrate baby stretching and massage techniques. This is Alexander. He's currently 5.5 months old and he's been getting massaged since his first week of life and has become quite flexible now. And we start off with rubbing some oil in between our hands and talking really nice. And then we rub a little bit of oil. This just lets him know that I'm about to start massaging him. He kind of relaxes and can anticipate what is going to happen next. And I always start off with just lubing him up, and then we finish off with some stretching. So, we're going to put some oil on your arms. And I always tell him what we're doing so that he can learn about his body parts. And we're going to rub the arm from the neck down. Yes, indeed. And then we're going to get all the way down to the little palm because it's nice to relax their hands a little bit. And then rub back up to their heart. And we're going to do the other side. We're going to rub the oil down. And get your little palm. And back up to your heart. Yes, indeed. Yes, indeed. And then you want to get the legs. That's right, we're going to get your legs. And you want to rub the oil down using a gentle but firm motion. And you want to then get the ankle and up the calf and the bottom of the foot. And then count. 1, 2, 3, 4, 5. And all the way back down. And then we want to do the other side. Yes, we're going to massage the other side. Yes, indeed. And then we want to get their little ankle and calf and the bottom of the foot. That's right. And count 1, 2, 3, 4, 5. And back down. There we go. And then we're going to roll him over and get his back. Now, you don't ever want to do baby massage right after they've eaten because that'll cause them to spit up. And you always just kind of want to do it the way that they like it. If your baby likes a soft touch, then you're going to use a soft touch. My baby likes a firm touch, so that's why we rub him firm. But never hard. You never want them to be sore. You want this to be an joyful experience for them. And also, if they're a little bit backed up, if you rub their lower back down here, this will help them to relax and get their little bowels moving. So you want to rub that downwards and up their spine. And the last thing you can do is a little pinch along their spine, which helps them to relax too. I like to also just kind of get his ears when he's in this position. And get the other ear. And you can get from their little temples here and all the way down. Okay. Then, now you want to start to focus in a little bit more on their tummies and some stretching. So, bless you. Oh, bless you. So this is when we really start to get their tummy focus. Which is like this. You're going to rub their tummy downwards to encourage their bowels to move down. Some people call this the windmill because you keep one hand on at all times. And then you're going to take your thumbs from the center out, just below their ribs. The center out. Yes, indeed. And encourage them again to get rid of any gas. And then you're going to do a clockwise circle because your bowels move in a clockwise motion. So encourage them to get rid of anything backed up. And you can always just do the half circle for the large intestine. Yes, indeed. And now we're going to massage you. We're going to stretch those arms down. And stretch the arms up, 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 up. And stretch the arms down. And stretch the arms up, 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 up. And stretch the arms down. And give yourself a hug and open wide. And give yourself a hug and open wide. And opposite, 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 opposite. Cross and open and cross and open. Cross and open and cross and open. And so this is how we limber them up. And we're going to kick, 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 kick. And dip. And kick, 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 kick. And in. And this helps to really start to get them going. And in, 2, 3, and down, and in, and down, and in, and side, and in, and to the side, and in, and to the side, and in, to the side. And then to really get out any excess gas, that's right, we're going to do the opposites. So you always want to do it where they're comfortable. You never want to stretch your baby too far because that will hurt them and pull muscles. My baby's quite flexible because he's been doing this since he was a newborn. And stretching them like this helps to ensure that they don't pull a muscle when they're learning how to sit up and crawl, where they tend to flop over quite a lot. And you want to hold it for about 4 counts. And if they grunt and groan while you're doing this, it's because they're getting out some excess gas or having a little poop, which is what we want to encourage. And it just helps make sure that everything keeps moving inside of them. And you can also count, so you can do it 1, 2, 3, 4. And then we're going to do it this way, which is a bit more of a twist. And open. And 1, 2, 3, 4. And this way, twisty, twisty, twist. Twisty, twisty, twist. Good boy. And open. And then we're going to do legs across. So this again just keeps our hips nice and flexible. And you can play peekaboo with them like this. Peekaboo, peekaboo, peekaboo. And you're just going to want to push the knees to the chest again very gently. They'll know where they don't want it to go to. And stretch it out. And you can always do this kind of cross stretch with them as well. As they sit, you'll notice they tripod a lot with their legs. So you want to make sure that they have as much flexibility as possible this way, because they'll flip forwards and fall forwards because they can't hold themselves up for very long when they're learning to sit. And then we just want to end it with a gentle rub along the eyebrows, just to relax any tension they have in their sinuses, and down their nose, and down their body, and down your little body. And that's it. Thank you for watching.